the Health Quality Council of Alberta. I'd like to welcome you to the HQCA's Quality Exchange, a place for healthcare improvement ideas that are worth sharing. For more information on Quality Exchange, you can go to the HQCA's website, www.hqca.ca/QE. Today we have some esteemed guests who work in the long-term care sector, and this leadership panel will hopefully inspire you to learn about the ideas that they fostered, their respective experiences and discoveries on their change journey as leaders in the long-term care sector. This morning's discussion will be facilitated by Andrew Neuner, Chief Executive Officer of the HQCA. Without further ado, I'll hand off the mic to Andrew. Thank you.
Thanks, Tony, and welcome everyone this morning to our first in hopefully what will be a series of events in the future, leadership panel discussion, the final chapter of our series featuring positive stories from within the long-term care setting in Alberta. For those of you joining us for the first time, just give you a brief history. The HQCA has been surveying family experiences in long-term care since 2007. Since then, this population has become increasingly complex with care needs that are uniquely individual. And as such, the desire to improve among the continuum care provider community is higher than ever. Although multiple factors are involved when making positive changes, what role does leadership play in creating or enabling the conditions that lead to improving the experiences of families and residents? We hope that this morning's discussion will help to unpack this complex question, and we thank you for joining us today. Just a quick note to everyone participating this morning is that we will be recording today's session for potential use in the future, and we'll also be putting all the attendees on mute until we get to the question and answer portion. Our goal this morning is for participation to be maximized. For those of you joining today via computer, here's a quick visual to illustrate how the chat feature can be used within the Zoom platform. To make this section as interactive as possible, we'd encourage and welcome any questions or comments you may have to be made via the chat option. So just by way of getting started and just practice a bit, if you could type into the chat area, what's your involvement or connection to long-term care? For example, are you a family member, a nurse? Are you in a leadership role? Just share with us just your role in the long-term care sector. Great, thanks Kai to get that started, and Mandy and others, terrific. Okay, we've clearly got the hang of it and certainly welcome everybody to chat as often as they like. So let's talk quickly about what to expect from the session. Our recently completed 4-part series highlighting some of the good work being done within Alberta's long-term care sector featured 4 specific facilities. These facilities were picked due to their improvement between our 2014-15 and 2017 Family Experience Survey, or by maintaining a consistently high ranking throughout the years. The stories we highlighted included a facility that created a breakfast buffet to reduce the morning chaos and better meet the preferences of residents, a facility that improved family communication following lower than expected survey scores, a group that strengthened their admission process and interdisciplinary teamwork approach to better support families, and a facility that has made significant efforts to improve care and services to residents and families at the end of life. All of these we feel represent strong examples of a commitment to person-centered care and a desire to improve the experiences of both family members and residents. So how were these facilities able to make these changes? Knowing that multiple factors are involved and that no one thing can lead to positive changes brings us to today's session. What role does leadership play in setting the tone or enabling change and improvement at the facility level, the executive level, and the structural level? As such, this morning we have 4 panel members joining us. 2 of them represent the facilities we highlighted through our Quality Exchange platform, and 2 of them are from other organizations to bring further perspectives. We had also planned for Lori Little, Director of Facility and Supportive Living from the Alberta Health Services Edmonton zone to join us today, but unfortunately, due to the wildfires in northern Alberta, she was unable to participate. However, without further delay, I'll let the panel members introduce themselves, and we'll start with Mike Conroy, who's the Chief Executive Officer of the Brenda Strafford Foundation. Morning, Mike.
Good morning, Andrew. Good morning, everybody. Pleased to be here.
And Kathy, would you introduce yourself?
Good morning, everyone. It's a pleasure to be joining you today from Sherwood Park. It's smoky here. I don't know what it's like in the rest of the province, but we're grateful to be inside.
And Blair.
Good morning, everyone. My name is Blair Halliday. I'm a Chief Operating Officer for Qualicare Health Services. We own and operate 4 nursing homes in the province of Alberta.
Thanks, Blair. And Jennifer.
Good morning, everyone. It's Jennifer McHugh. I'm the President and CEO of Bethany Care Society. It's great to be with everyone today.
Thanks, Jennifer. So we have 5 questions today, and the process will be is I'm going to put a question forward, and the panel members will be providing their input. So the first question today is, thinking of the things your organization is doing to make the experiences of family members better, what are you most proud of? And we'll start with Mike.
Great. Thank you, Andrew. I think what I'm most proud of is how our board, staff, residents, and families have meaningfully engaged to develop and implement a plan of change that's focused on resident and family-centered care. In our last planning process, we identified that we were starting to see a different type of senior. And historically, and even to this day, the long-term care, continuing care sector has served what I describe as war and depression era seniors with very much different expectations than what I would call the baby boomers. The baby boomers want to participate more in decisions that affect them. They want more choice. They have more access to information. They're much more comfortable with technology. So we're trying to look at how we position our organization to be successful with this changing dynamic. And we've developed something called the Brenda Strafford Foundation Way, or the BSF Way, which is our approach to resident family-centered care. And it's based on 4 principles that were developed in concert with our residents and families. And they are: our care, services, and environment will be personalized, supporting choice. Our care, services, environment will be enabling, enable abilities, enable interests, enable aspirations. Our care, service, and environment will foster positive interactions and relationships, both within our organization and with the local community. And lastly, our care, services, and environment will invoke a sense of belonging. And we've got a number of initiatives that underwrite the realization of these principles, again, all done in concert with residents and families, starting with things like our leadership development approach, staff education, culture change, reviewing all of our core processes together with resident families, identifying opportunities for improvement, and excuse me, and so those are some of the things that we're doing in terms of supporting this change initiative. And we're already starting to see some of the results where we've got resident families involved, for example, in our renovation planning, design of new buildings, policies that affect them, trying out new technology, things like menu planning through the Chef's Club, those types of things. So again, going back to my original point, how this has galvanized our staff, residents, and families around an opportunity to make improvement, to make sure that we're as future ready as possible. I think that's what I'm most proud of.
Great. Thanks so much for that, Mike. Jennifer, what are you proud of?
Andrew, I think that I'm most proud of the work that Bethany has been doing over the last several years around our vision for creating campuses of care for seniors. And so we're very excited with the opening of our new Bethany Riverview Care Center because it brings care to a campus that is already home for 400 seniors living independently. And I think that what this vision allows us to do is to support families and residents and tenants to live together and to age well in that community. And I think it really does enhance the experience for people. We have folks that are living in our care sector, their spouses or their siblings are living in our housing, and we're able to work with that entire community, which I think for families is a very reassuring thing, and something that our staff have really embraced, and something that we hope to do at all of our Bethany sites over the next number of years. So I have immense pride in how our teams have come together to be able to achieve this vision.
Thanks. Thanks for that, Jennifer. I can hear the pride in your voice. Blair, what makes you proud at QualiCare?
First and foremost is I'm really proud of the fact that our staff have really got accustomed to understanding that the reason we come to work every day is for the benefit of those little old ladies and old men out there, our residents, and have really become passionate. And I think a combination of that has resulted in our surveys being, very good. I'm quite happy with the survey results because it indicates to me that the families feel we're doing what we should be doing, and the residents feel that we're doing what we should be doing. And I think that all comes from just trying to be open and listen to the residents and their families and communicate as effectively as we can, whether it be face-to-face, newsletters, brochures, offering educational programs, those sort of things. And then as a result, we've been able to facilitate change. Of course, there's certain things that families and residents want that don't make sense or outside of your fiscal abilities to do it. But we've been able to tweak things like menus and recreation programs and the dining experience and so on. And so I'd say, all in all, I tell our staff, this is one career where you should be going home every night and feeling really good about yourself because you've made the lives of the elderly that much better. And I get quite a few comments. Of course, we all have the, less than 1% of families that you're never going to please and cause you most of your grief. But I get a lot of families that come to me and say, in very emotional, saying, your staff have gone a long way to make the life of my loved one that much better in the last chapter of their life. So that's what I'm most proud of.
Great. Thanks, Blair. And just before we move forward, if any of the panel members had any other comments they wanted to add, and a reminder to folks listening in, if you've heard something and you'd like to learn more or have a question, by all means, put that into the chat room there, and we'll have time to get to your questions. All right, let's move on to our second question. And question is, what role do things like family experience surveys play when doing the work of making improvements or changes? And what would help you more? Let's start with Jennifer this time.
Thanks, Andrew. I think that it's hard to express how critical the feedback is from our family and our residents. In our world, the information is foundational to when we're looking at improvement initiatives and enhancing the experience for both the residents and families. I think our Bethany's Service Excellence Program is a really good example of that. It is a program that focuses on how we care not only for our residents and families, but for our staff. It's called Bethany Wave and was born really from feedback about how staff are interacting with folks, how they're handling their belongings, even simple things like how they identify themselves and how they're going to provide care. I think the other example for us is we've undertaken over 70 initiatives based on family and resident feedback around the food experience and the mealtime experience for our families and residents. Our families told us and our residents told us that they wanted something different and better. We need to customize those things for communities and for different backgrounds. And so I think that the feedback is just absolutely critical to help us do the right thing to make that aging experience more positive. In terms of what I think would help more, I think that it would be very helpful for us to get feedback in real time versus people waiting to provide responses in surveys. We want to make changes as soon as we can, and I think opening those lines of communication and really working on improving that is critical to making sure that we're doing things quickly in response to patients and our families and residents' concerns.
Great, thanks for that, Jennifer. And I know that's a priority for us to make the information more timely for you and others out there that participate with us. Kathy, your thoughts?
Thanks, Andrew. Something that I find consistently with the feedback we get both from the HQCA Family Experience Surveys and from our own surveys that we do with families on a regular basis is usually the themes Family Express are not new to us. That, you know, you might have this idea of this area you need to do improvement in, and then you see it written out or clearly stated by the people we're serving. So often it's areas that we're currently working on or seeking to improve by the time we get that feedback. I would agree with Jennifer, this feedback is critical to what we do moving forward. So whether it is how we train our staff, the education that we provide for them, the way we communicate with families, the supports we provide to families and the residents, the feedback really becomes integral in how we set our strategic plan and how we focus our efforts and energies when we're looking forward in continuing to provide quality care to our population.
Great, thanks, Kathy. Any other thoughts from the panel on this question?
I'd just like to say that I think the Family Experience Survey is a terrific idea. We do it internally as well once a year. And the one thing I've always noticed is the number of responses we get when we do it ourselves is much less than when it's done through the Health Quality Council. So I don't know why that is. Maybe people feel better responding to Alberta Health Services versus us internally. So I think it's great. And I agree with Jennifer. The only thing I would say is it would be nice just to get that feedback a little quicker so you could act on it quicker. And then just another small item is some of the questions are a little bit, you know, you sort of know what the answers are going to be, and they're questions that we really can't do anything about or not prepared to do anything about. So there's a few questions I might massage a little bit. But other than that, I think it's a terrific idea. And it helps, once you get the information, of course, you need to sit down and engage the whole team and try to deal with any of the concerns.
Yeah, Andrew, it's Mike, and I agree. I think that having a independent, objective survey like this is really invaluable because it provides that level of integrity to the information. Not that other sources don't have that, but it's just another level. And I think it speaks to probably why in Blair and ours experience also, the participation rate is typically higher when that happens. I also like the fact that you can benchmark or compare to other facilities, and it opens up a dialogue with other facilities. If you're having an area where you're looking for improvement and you've got a facility that has, or where the family resident experience is rated quite high, it allows you to have that discussion with them. And secondly, it really allows you to ask further questions and provide that opportunity for further engagement with residents and families based on the results. And the only thing, notwithstanding the timeliness of the results, but I would also encourage, without making it overly cumbersome, to also complement the questions with an importance or relevance, to really try to tease in what's the most important of these areas for residents and families, so would allow us to target our improvement efforts a little bit more.
Great, thank you, and thanks to all, and we certainly appreciate the feedback and take that to heart. We want these surveys to be the best tool that we can make them for you in providing care for the residents, and the numbers in the surveys are important, but the conversations that you're having because of the surveys is probably more important. Let's move to question 3. And how do you find balance between standard-centered care and person-centered care? Let's start with Blair.
Well, as all of us know, really we're in the customer service business. And in order to do our job, we have to meet our customers' needs, or in our case, our residents. Having said that, we have to do that within a defined set of parameters. We have a certain, funding limitations and human resource requirements, so we can't be all things to all people. So one of the things we try to do is really communicate effectively and early. So things like on pre-admission or when we're doing tours, we do tours generally one-on-one or with one family. We used to do group tours. Now we'll just tour one family so that we can answer private and confidential questions and so on. And then we try to get as much information as we can. So we might learn through that process that, Mrs. Smith wants to play bingo every Thursday, or, she's an introvert, and it just kind of allows us to really get to understand what her needs are and devise the care plan accordingly. And then the other thing we did, and over the years we really wrestled with this, is we used to move staff from wing to wing. So if one wing was heavier than another, the feeling was, you know, these people shouldn't work in that heavy wing forever. They should move to another wing. And we stopped that. Now we have staff dedicated to each area. And the reason for that is they get to understand the residents' needs and the family's needs. So, you know, if Bob wants to be shaved at 6:15, you know, a healthcare aide who's been there for a year knows that Bob wants to be shaved at 6:15. And so we found that that's worked very well for us. And then the other thing we've done is we've tried to remove any obstacles from the healthcare aide. So families that, you know, want a lot of attention, have a lot of questions, or maybe have some concerns, we do our best to try to redirect those families to management so that the healthcare aides can do what they're paid to do and avoid dealing with those sort of things. And then I always find what's good about what we do, we're not really in competition with each other. You know, it's not like we're manufacturing widgets and we don't want anybody to know our trade secrets, but we can pick up the phone and call each other and get ideas. And so, you know, we're always doing that, getting best practices from other ideas, other sites, you know, and improving our processes as a result of that. And then I would say lastly, just working very in depth as an interdisciplinary team, you know, just really trying to share the information and, you know, understand changes in residents and what the expectations are in the families and so on. And it's getting tough, as Mike said earlier, you know, the acuity is rising and it's getting more challenging, but I think all in all, it's working.
Great. Thanks so much for that, Blair. Kathy, what's your experience been?
You know, we all are in healthcare and we know that there are, you know, regulations and standards and that's appropriate. You know, sometimes those standards seem to get in the way of being person-centered. And it's that reality of us living and working in kind of a medical model environment, but really we're supposed to be providing care based on more of a social environment. And so I think that's a conflict that we all work with on a regular basis. Some of the things that we've done as an organization to try and address that or to overcome it is to really engage both our families and residents and our frontline staff on how best to address and move forward. So we do spend a significant amount of time in the pre-admission and admission and first 4 to 6 weeks in our facility, because understanding those individuals that are coming to live with us, hearing the families, understanding their concerns, and really working to build that relationship and trust at the beginning is key. I think we all have been in an experience either personally or as a care provider where something has gone wrong in our environment or in care. And if the trust has already been established, it's easy to work through that. But if trust hasn't been, it's really difficult to recover. So building that trust at the beginning is key. Some of the other things that we really work on is we really rely on the whole interdisciplinary team. So we look at which member of the team has the best relationship with that resident or that family, and they become that person who provides direct feedback. So whether it's the healthcare aide at the front line, maybe it's a social worker who has a better relationship with that family member, that spouse, than the care manager. And we work together to make sure that that person has the best connection, makes those contacts, and hears the concerns, and certainly works forward to try and address those issues as soon as they come to our attention. I think the biggest thing is really listening to creative ideas from the front line. We tell our staff that if they have the expertise and the knowledge and the ability, we will not overturn decisions they make unless it brings harm to the organization. And that's really our goal, to create a creative environment where they have that ability to make the best decision in the moment based on what they see and what they know about the person they're serving, rather than that having to come from a formal policy or a rigid structure that they have to live within. So allowing them to be creative with the skills that they have, and ensuring, of course, that they're properly trained is one of the key things that we really rely on to give person-centered care. I'll give you just an example of what we've done recently, because this extends beyond our residents to our families, we have a large group right now of husbands whose wives are in our facility. And these men are very engaged. They're present on a daily basis. They're very active in what's happening. They've got lots of questions. When they see any problems, they want to fix them all. So we have started a men's spousal support group, our chaplain and our social worker. And they go off site once a week for lunch and just kind of talk about the challenges of having a spouse in care, what it means for them. And it's really been beneficial for them, for their spouses, and just for the team as a whole, because they're getting that venue and that support to be able to talk about those things. So although it's not directly related to their spouse in the building, the one that we're serving, it certainly supports them in the role that they have in our organization.
That's a great idea, Kathy. And any other panel members want to weigh in on this question?
Yeah, Andrew, it's Mike. I would just comment that standard-centered care and person-centered care aren't necessarily mutually exclusive or at variance to each other. Actually, as you know, in healthcare, there are many standards that are based on proven evidence in terms of the efficacy of the standard. But it's also an opportunity where that standard applies to families and probably more specifically residents, is to explain the benefits of that standard. So it is aligned with person-centered care. But to Kathy's point, if there are regulations and standards that perhaps don't make sense in the line of sight to the benefit to the residents and families in there, we should be challenging those standards and regulations, because they're actually operating against the objective of person-centered care.
Great. Thanks, Mike. All right, let's move on to the next question. When working to improve experiences of residents and families, what keeps you up at night? Kathy?
I don't want to simplify what we do, because it's a very complex industry that we work in with a variety of needs. But I am very clear that we work in a people business, and we are, as leaders, are looking after people who are caring for people. And so I would be really honest and say to this panel that if there's anything that keeps me awake at night, it's about the quality and engagement and the well-being of the staff that work in our organization, because I believe that the quality outcomes for the residents and families is directly related to the people who are providing that care. So my burden for the staff and for their well-being, for our program that supports them, for education that trains them, for the mentorship that we do, are probably the things that rattle around in my brain a lot when I'm thinking about this organization.
Thanks, Kathy. And just before we move to Mike, a reminder to folks who are listening in, if there's something keeping you up at night, just put it in the chat box, and we can have a conversation about those things as well. Mike, over to you. Yeah, thanks, Andrew. We're very fortunate in healthcare. As you know, we've got people that are well trained and typically highly motivated. It's almost like it's a calling for a lot of folks. They're very busy and they have a lot on their plate. And it's what keeps me up at night is really, how do we honor our commitment to resident family-centered care in the full scope of how we're starting to define it, and support our staff to deliver on that promise together with the busy activities that they do, meeting the needs of our residents. So that would be one thing. The other is, this is not a two-step process, i.e. we make change and we're there. This needs to be very dynamic in terms of the change agenda that's before us. Technology is always changing, expectations will continue to evolve, those types of things. So how do we embed that adaptation and that learning within an organization to make sure that we're keeping pace with the changes that our resident families will expect of us? Great. Thanks, Mike. Jennifer, how's your sleep patterns?
Well, Andrew, I do stay awake at night sometimes thinking about things. And I think for me, to build on what both Kathy and Mike said, is for me, it's really the misalignment between the needs and expectations of our residents and their families, and how we're funded and some of the limitations around that. to Kathy's point about staff and the well-being of staff, the survey results tell us that in most cases, families see staff working really hard and residents see the same thing, and that there just aren't enough of them being able to provide the level of care and for the complex needs that our residents have. And also, you know, we talked about the issues around standardization and care, and this is a resident's home, and so we need to focus on that holistic care, and that involves making sure that their social needs are met. You know, we as an organization rely on over 1,000 volunteers to help us do some of the things that we do. We rely on donors to raise funds for music therapy and purchase equipment, and so how do we reconcile all of the things that we should be doing to ensure a good quality of life with some of the challenges that we have within the system? So I have to say that I spend a lot of time thinking about that, and I know as a sector we spend a lot of time talking about that, but it would be really nice to see some change moving forward.
Thanks, Jennifer. Well, let's go to question 5 and give you all a magic wand. So if you had one wish to make the experiences of families and residents better, what would that be? Mike, we'll start with you.
Thanks, Andrew. Well, I'll take a bit of a system perspective on this because I think this would help the health system across the continuum. And from my perspective, you know, the health system is somewhat of a monopoly or oligopoly in terms of the provider mix. And if we were to move more of to a voucher type system where people would have their assessed needs, they'd be allocated resources. And when I say resource, there could be a component for capital also. And then they could choose how their services are provided, whether it's at home with augmentation, different providers, et cetera. I also think a system like that would break down barriers to entry into the market. So this would support resident family choice because they could choose whether to actually engage as a service provider like us or not. And so that, I think, would act as a further catalyst for organizations to be much more responsive and sensitive to the needs of residents and families.
Great, thanks, Mike. Blair, what would you wish for?
Well, I think as it's been discussed with the panel already, you know, obviously needs of our residents are increasing as well as family expectations. So clearly additional funding or human resources would be adequate. But I sort of looked at it, you know, on the basis that that likely isn't going to be available in the foreseeable future. And so I guess my one wish would be is I'm trying to get our staff to do a better job of managing expectations. You know, sometimes when families come in, they think there's going to be an RN at their mother's bedside 24/7, you know, and they're going to get rehab and walk out of the building in 3 months. And so we're trying to just really do a better job of managing the expectations of families. And so, you know, it gets their expectations down lower, and sometimes it works and sometimes it doesn't.
Thanks, Blair. And just a reminder again to everybody that the chat box is ready to accept your wishes. Jennifer.
So, you know, if I had a wish, it would be, I would acknowledge, as Blair did, that funding and changes to the funding model are not, maybe not coming as quickly as we would like. So I would just like us to see changes to the system that would support folks to age well in their community, to age well with spouses or siblings, and also some systemic change around system navigation, because I think when we have new people coming into our sites, they are so frustrated by their experiences in the community and figuring out how to navigate what is a very complex system, even when you work within it. So I think there's lots we can do to change the system and to really improve the experience from start to the time people come into continuing care and then beyond. So I wish for systemic change and work on that as we move forward.
Thanks, Jennifer. Kathy.
I agree with what all the other panelists have said. The one area that I think would ultimately improve the experience for families and residents is if we as a province, as organizations, as a system, did a better job of measuring quality of life indicators. Not apart from healthcare quality indicators, but really looking at quality of life and understanding what that means for the people that we're serving. And that's really what person-centered care is about. I know there's work that is happening in some organizations. I know Alberta Health Services is beginning some work on quality of life. But I think for this population to serve quality of life is a huge area that we kind of don't fully understand and don't kind of set up our programs and our systems around. And I do think it would have good outcomes for everybody involved.
Great. Thanks, Kathy. So we're going to move to a question and answer period where you can submit questions to the panel. And I see a question from Kara. And before I ask the question of Blair, Kara, because you're so brave to be the first one in the chat box that asked a question, send us your coordinates and we'll send you an HQCA bag of swag for being so brave and getting the questions started. So Blair, in response to Kara, how do you get buy-in from the staff to stay in one wing?
That's a good question, because in those situations there's always people who are happy and people aren't. I find the ones that are happy, of course, it's not a heavy wing, they're working with their best friend, and then the ones that aren't happy, it's the most difficult family or it's a heavy wing. And I guess we've really just tried to sell the staff on the fact that we're here for the benefit of the residents, and it's really important that you get to understand their needs, and that takes time. And of course, the needs change. So if you have a constant turnover of staff in that particular wing, it's harder to manage. Having said that, if we had a situation, which we do, where one wing is heavier, or maybe also in that wing there's some difficult families, sometimes we'll try to move those residents, or as residents move on, we'll put lighter residents in that wing to try to get some balance over time. But also, if someone does come to us and says, I would like to move to another wing, we would entertain it, of course. It's not sort of a hard and fast rule, but generally I would honestly say, because it's become part of our culture, the majority of the staff are happy where they are, because I think they just understand that's the way we operate. And we do try to help out those ones that are in difficult areas, and like we have a hospice wing, for example, in one of our sites, 6 beds. And hospice is tough because, there's people that are in there for 2 weeks, young people, and they pass away, and our staff struggle with that. So that's one area where we've left it completely open. We've said, what, if people want to move out of there, we'll move you out. And we have people who like it there and people who want to just flow through it, and people who don't want to spend a minute in there. So, but generally I would say, honestly, it's worked well. And we flip-flopped back and forth with this for years. And I think now we think we have the model that works best for us.
Thanks, Blair. We certainly hear from residents that familiarity with the same providers, the same staff is really important to them. Do any of the other panel have an experience with staffing and how you support residents to become more familiar with their care providers?
I just wanted to make a comment about, to follow up on what Blair said. We have done the same thing with staff who are focused on one unit. And actually, I try every summer to float everybody off to give them 2 weeks off, and they dislike floating off the unit for any period of time. They take ownership of their space, and they are very happy to be in that environment. So it gives them a sense of pride and belonging, both for them and the residents and families, to have consistent staff members.
Great, thanks, Kathy. Okay, questions are coming in. Blair, we've got another question here. I'm assuming this is about union involvement in team meetings or decision-making for the care staff. And that comes from Pam.
Sorry, what's the question?
The question is, do you have union involvement for the care staff?
It depends on the site. depends on the site. We have unions in 2 of our facilities, and then staff associations in our other 2 facilities. So I would say the union doesn't get involved unless there's a grievance or, of course, bargaining.
Okay, great. Thanks, Blair. Jamie's asking if nursing aides that do some of the most important work but are probably paid the least, any tips on keeping the nursing assistants engaged, happy, and fulfilled in their work? And that goes to everyone.
Andrew, maybe I'll tackle that. I think one of the things that we have found that really does engage our nursing or our healthcare aides and gives them job satisfaction is to be part of the conversation about solutions around care. So they are working with our residents and families every day. They see what the challenges are. They see what the care needs are, and to engage them in conversation about how to do their jobs. I think, sometimes we think that we have a manual that tells everybody what to do, but some of our best care ideas come from our care staff, and they love to be part of research projects and all those sorts of things. And I think the other thing is investing in education. We need to provide them with ongoing continuing education that's relevant to them, that meets their needs and expectations. And I think that's, a really important way to keep your workforce engaged.
Yeah, and Andrew, one of our approaches around our BSF way is something called PIT teams, which is an evidence-based approach to change. And that stands for Process Improvement Teams. And those teams are made up of frontline staff, residents, and families. And they're looking at all of the core processes, typically selected by residents and families, that have the most meaning to them. And to Jennifer's point, by actively engaging staff in the decisions and changes that will affect them, getting their ideas has proved to be incredibly powerful and beneficial. And so, that's one item, certainly engaging staff in meaningful change and actually having them be the leaders and the architect of that change. Supporting them with recognition and feedback is another. And simple things, whether it's education, but making sure they have the equipment, communication, the information they need, etc. So, it's not so much a monetary driver. Again, these folks are highly motivated and typically well trained, but they want to be able to be given the opportunity to do their best work, and it's our obligation to support that.
Great, thanks for that. I see a question here on the level of engagement with families and residents in selecting survey questions. So we have a sampling of families and residents that work with us when we come into our survey cycles, where we do a lot of usability testing to make sure that the questions are appropriate and the comprehension of the questions is also appropriate. So they're very engaged. We also do a lot of qualitative work. So we go out to the sites and we talk to the residents and capture their experiences in that format, and we report back on that. So last year we released a report called I'm Still Me, which highlighted some of the experiences of residents in long-term care. And shortly we'll be coming out with another report on the informal caregivers, those people who take care of loved ones in their homes who don't go to facilities. So a lot of engagement on that end of it. And just ironically, we're training 10 surveyors for the summers, or interviewers for the summer, who will be out in the assisted living facilities, chatting with residents and capturing their experiences as we launch our next set of surveys. So we're very engaged with the residents and families. A question here for anyone. How do you link the feedback collected from the survey to prepare your facilities for audit?
Just to clarify, Andrew's audit meaning what, accreditation? Or
I have CCHSS here in brackets, so I'm assuming that's Accreditation Canada.
Like continuing care standards.
Yeah, continuing care.
Oh, yeah. Okay.
Yeah. So maybe I can tackle that a little bit. So our philosophy at Bethany is that we are always audit ready. And so instead of studying for the exam, we're just, our go forward is that we simply are ready when any audit is about to appear. So we just, in terms of survey results, we incorporate that in when we receive them. We do check-ins throughout the year on compliance to all standards, including our accreditation standards. And so it becomes a way of being versus just an event. And so whether it's survey results, audits, accommodation audits, accreditation cycle, it's really become who we are and what we do and how we live every day. So I think, it's an important way to be instead of just always kind of anticipating something that sometimes has a very negative connotation. So that's how we approach it.
So I have a pretty strong perspective on this, Andrew. We of course are subject to audit, and I think that's great. I would rather them all be unannounced, including Accreditation Canada, to Jennifer's point, because we should all be audit ready. My frustration comes from, and this is longstanding, especially with Accreditation Canada. So we had a survey, we did very well. Then I talked to them, and I knew the answer because I've asked them this before, but I wanted to see, okay, what's the correlation between Accreditation Canada standards and outcomes, clinical satisfaction or otherwise? And so, because if these standards are based on best evidence, et cetera, they should, if you're in high compliance with those standards, render positive outcomes. To date, they don't know. They don't know how it affects the inter outcomes. They don't know how it affects satisfaction, even though they have a developed employee satisfaction tool, et cetera. And that to me is a great source of frustration, because a lot of time is occupied in making sure you're in compliance with these standards. But those folks that are developing and implementing those standards should have a duty to explain how those are linked to outcomes, both qualitative and quantitative.
Yeah, great point, Mike. We measure so many things. We probably measure far too many things without understanding what the outcome of that particular activity is. Just to respond to Leah's question there about challenges serving residents due to cognitive barriers. So we do send some of our folks out into the field to capture the voices of those people who are unable to complete surveys on their own. Of course, we don't get to talk to everyone, but we do make sure that we captured some of those experiences as well. And it's one of the main reasons also that we talk to families who then can advocate for their family members. And we certainly understand that a family member's perspective is not always the same, but it's one of the reasons why we do include families in the survey. So we're getting close to that top of the hour here. So we have a feature called a whiteboard space, and you can write anonymously on the whiteboard, and probably should have activated this earlier for the folks on the line, but when you see the whiteboard appear on your screen, you can just hover over the toolbar and click annotate. And if you have problems with the whiteboard, you're welcome to use the chat function, and Jen will paste it into the whiteboard for you. Or you can just speak to your ideas, but we will sort of leave that whiteboard there. It's something we've not tried before. So there's a question we sort of posed for you, and if people want to weigh in with some responses or ideas, we're happy to capture those. As well, before we close, we do have a short poll, and if you have a minute to spare, we're going to send that out, and Jen will launch that poll. So for those who are able to stay on the call and complete that poll, it helps us improve what we're doing in our work here at the HQCA. Again, up next in Quality Exchange, we will be doing a series in primary care. And we look forward to learning from the experiences in that particular sector. We hear lots from primary care, but we have yet to share some of the stories, so we're going to do that. And I really want to thank our panelists and to the participants today and those who listened in. Great to hear voices of individuals who are in leadership roles, but most importantly, and I think we'd all agree by listening to their responses, who care very deeply about their residents and families, who care deeply about the staff who provide the care, and who have great insights and experiences in terms of how to best meet the needs of the people we serve. So a big thank you to those folks on the panel. We'd hope we can do this again in the future around other topics. And to Kara, your swag bag will be on the way. And oh, the poll has just shown up. So for those on the line, if you could just quickly submit your answers, that would be great and help us plan for the future. And with that, again, a final thanks to all who have supported the Quality Exchange platform to this point, and we look forward to working with all of you in the future. Thanks so much.
Thank you.
Thanks, everybody.